To everyone, thank you for the members of the press that are here today to cover this press conference. We want to wish each one of you a Happy New Year's as we enter into a new year. Today, as we stand here right in front of the Tournament of Roses parade headquarters, we are here to remember the 350,000 people that had fallen victims to COVID-19. These are Americans just like you and me. These are people. These are families. These are moms. These are dads. These are some of our children. Many of them who have left loved ones behind. And as you know, and as we have witnessed, many of them have died alone. It is tragic what has happened in the United States, the way this has been handled. But we are here today to pay remembrance to their memory, remembrance to their lives, and how special they were to their families. Our condolences to each one of the families that have suffered loss. We're also here to bring a special message, and that is a message moving forward. What needs to happen? By far, this pandemic is not over. We are in the epicenter here in California, and there needs to be certain steps that need to be taken. Moving into these new years brings hope for people, and we have a new president coming as well. But with that, we also have the worries that this is not under control. We don't want to have to be standing here next year again because COVID-19 has not been brought under control and because there is not enough resources, etc. But the message that you're going to hear today is very, very important because it affects millions of people. And it is the message of healthcare. So with that, I would like to start introducing our speakers. Erika Feresten.
Thank you, Carlos. Good morning, everyone. Thank you so much for being here this morning. My name is Erika Feresten, E-R-I-K-A, Feresten, F as in Frank, E-R-E-S as in Sam, T-E-N. I am the Director of Healthcare for All Los Angeles, along with Maureen Cruz. And toward the end of our speakers, you'll hear from one of the members of our executive board. We are a statewide nonprofit organization dedicated to achieving a universal healthcare system through public single-payer financing that guarantees all California residents comprehensive, high-quality health care. While our focus is on the state level, we do at times join national efforts to achieve Medicare for all, and we are proud to endorse the Force the Vote campaign to pressure Nancy Pelosi to bring Medicare for all to the floor of the House for a vote in January. The United States is leading the world with COVID-19 cases because our profit-first, corporate and predatory health industry puts profits above people, and its capitalist greed has created the perfect incubator for COVID-19 to thrive.
That's right.
But we're here with a message of hope, and this can be turned around, and California can lead the way. California can lead the nation with improved and expanded Medicare for all. Countless studies from Yale to Stanford over decades have repeatedly proven that a single-payer Medicare for all healthcare system saves money and saves lives. In California, we had a bill in 2017, SB 562. Had that single-payer Medicare for all bill passed, the state would have saved $111 billion
That's right.
by the end of this last year, 2020. Imagine what we could have done with $111 billion. Imagine the lives that would have been saved. And so today, as Carlos said, we are here to pay our respects to those who have died from the coronavirus, but also those who are still suffering and dying at the hands of our profit-first medical industrial complex. And we are here also in the spirit of renewal and hope that California can and must lead the nation with single-payer guaranteed health care for all. And so with that, we have a few demands for Governor Newsom.
Right.
Number one, apply for the necessary state innovations waivers from the Federal Health and Human Services within the first 100 days of the Biden administration.
Yeah!
Number two, lobby your supermajority Democratic state legislator to introduce a California single-payer Medicare for All bill and promote its passage within the first 100 days of the Biden administration.
And listen,
And finally, Governor Newsom, we want you to publicly pledge to the people of California that you will sign this single-payer Medicare for All legislation by the end of your term in 2022.
That's right. Hello.
So again, thank you for being here, and I'm going to turn it over to our next speaker, Akili.
That's right.
Good morning and Happy New Year. My name is Akili, A-K-I-L-I. I'm with the Fannie Lou Hamer Institute and the core team of Black Lives Matters LA. But more importantly, and unfortunately, I am here because those 350,000 people represent families. In my family, we lost my cousin, my first cousin, who I grew up with. My first cousin, who was the keeper of the information in our family. My first cousin, who was the connection in our family to our parents, our grandparents. I lost my cousin because she couldn't get the same kind of government health care that the president got. I lost my cousin because she couldn't get and didn't get the kind of attention and resources that the President of the United States got with his government health care. I lost my cousin because this country had a mismanaged and inappropriate approach to handling this pandemic. I blame this president and I blame the governor of Florida for how they handled this pandemic. And so these 350,000 numbers that you see represent names and families, represent people who have lost folks. We cannot ever replace those people. We can never replace what we have lost. But today is New Year's. Today we can start anew. Today we can start with a national health care system that makes sure we are all a part of it. And it's a simple thing. We've seen it before. It works around the world. You don't need to be a rocket scientist to figure it out. I want to thank Healthcare for All California and LA in particular, first of all, for bringing us together. Secondly, for making sure that we remember. And then finally, for developing and advancing the demand that we want health care for all in California. And we're calling on our governor to meet these demands. We're calling on our governor who said that he supported single payer.
That's right.
We're calling on our governor to make sure that he responds and to live up to his own commitment And more importantly, we are calling on the supermajority here in California to live up to their commitment, to fight back against the corporate insurance companies that have held us all back. We are calling on the governor to do his job so that we don't continue to add names and numbers to this list. Health care for all is a simple saying. Single payer is a simple way to do it. That's why we stand with Health Care for All LA, and we support their demand. So thank you very much. Paul? Good mic holder.
Good David!
All right, David!
Morning everyone. Thank you so much to Healthcare for All, to Maureen, to Erika, and all the people who have been donating their time generously and working so hard and fighting so hard. My name is David Monkowa. David, D-A-V-I-D, Monkowa, M like Mary, O like Oscar, N like Nancy, K as in kangaroo, A-W-A. And I'm with Progressive Asian Network for Action, and I was a former National Assistant Organizing Director for the California Nurses Association. I've always thought myself as an activist for Medicare for All. I thought it was a good thing, you know, because I'd had certain experiences in the past which made me realize that. But you know, I never thought I'd be a poster child or a victim. You go around and you advocate for Medicare for All and other issues, you know, and to a certain extent you kind of feel invincible. You kind of feel like you're the one bringing the issue to people. You're the one that's introducing people like Akili and others who had personal losses. And I never thought that I'd be one of the people that's on the receiving end of the injustice. Over the past year, and especially in the past few months, my son, Alan, and my daughter-in-law, Kelly Smith, they had a child, premature, Alex. And he stayed at Children's Hospital, Los Angeles for about a month in the neonatal intensive care unit. Yesterday, he passed away. And he was 2 pounds, 7 ounces. And there was something wrong with his lung, and it wasn't growing as fast as the rest of his body. He passed away yesterday after about a month. He died in his mom's arms, and he was agitated and held his finger of his mom real tightly as he lay still. And so we're kind of like all in private mode for right now. But we're kind of bracing for the bill, because although we don't want to talk about it, it's right there and it's kind of like eating us up. One day in the NICU for what he's getting is about $5,000 a day. Now they got insurance, but we don't know what's going to happen because they're not going to pay for all of it. If you do the numbers, basically they're going to lose all the savings that they're trying to save for a house. So not only do they lose the child and my grandson, but they might lose their ability to buy their house too. A 2-for-1 for the system. That's why we fight for Medicare for All, isn't it?
Yes!
The other thing, right before that, my stepfather, 92, falls for the 3rd time. He has to go to a nursing home. He can't come back no more because if he's standing by himself and he falls, my mom cannot do anything about it. So he can't come home. He's stuck in a nursing home permanently. But you know what? I tried to get him into one, and as soon as I said he's on Medi-Cal, guess what they said? Oh, I'm sorry, we're full. We ain't got no room. Well, you didn't say that before. When you go to another nursing home, you're telling me from Medi-Cal, same damn thing. Oh, I'm sorry, we're full. I never knew this. I always talked about how insane and unfair it was, I never knew it was going to happen to me. Finally, the only way he got in the Skyline Nursing Home, where they have 17 COVID patients out of 100 now, and 12 staff, is that emergency, after he fell, had to refer him into a nursing home. And then after that, I had to make sure that he never got out for x-rays or nothing. Because as soon as he gets out, they're going to try to kick him out permanently. That's the kind of bullshit that's going on every single day in California and the nation. That's what's going on right now. It's the same kind of insanity. If you came home and you found your house is on fire, and you called the fire department, and they come over here, and they say, hey look, where's your fire insurance? And then you say, are you out of your mind? The whole house is burning down. The neighborhood could go. Well, that's what's happening right now. You might think that's just mad, but it's happening right now every single day. Because when you walk in with a fever or some other weird symptom, and you go up to ER or urgent care and they tell you, sir, what's the source of your income? Or what is the source of your payment? It's the same damn thing, and you got to go back home if you don't got none, and you're going to spread those germs all over the city. It's just like it's burning down. Isn't that the right thing?
Right.
And that's why we fight for Medicare for all.
Yes.
So join me today to demand that Governor Newsom lead us into getting Medicare for all. And I saw Governor Newsom with my own eyes several years back, wanting the support of the California Nurses Association and everybody else. And he promised, I will sign single payer. I will sign Medicare for all. If you support me. If you support me. Well, you know what, Governor? Live up to your damn promise.
Right.
That's why we fight for Medicare for all. Thank you very much.
Yeah, Elizabeth.
Hi everybody, my name is Elizabeth Castillo, that's E-L-I-Z-A-B-E-T-H, Castillo, C-A-S-T-I-L-L-O. I'm a registered nurse. I've been a registered nurse for 12 years. I've worked in a hospital for 12 years. I'm also a sexual assault nurse examiner, and I see patients in Orange County and LA County. I'm also part of the LA County Democratic Party and a member of Healthcare for LA. So thank you so much for having me here today. So I want to talk about what's happening in our nation and in California specifically, and all the deaths that we have had in our nation, 350,000 plus probably more than that are uncounted. The devastation is heartbreaking to me to see that our people are suffering and dying right now during a pandemic, and our leaders are doing nothing to solve this issue. They are not doing anything about the corporate greed that's going on in our country. In fact, they are giving bailouts to hospitals and to the insurance industry and other corporations, which is criminal. So I just want to talk about a story that I read yesterday in the newspaper, Long Beach Post, about a gentleman who died, 31-year-old Latino male in Long Beach who died. I won't say his name out of respect for his family and friends. And I thought, wow, you know, his family called 911 to come and take him to the hospital, and the paramedics showed up, and they told him to stay home and rest. The next morning, his father went to check on him, and he was dead. That's what we call rationing care. That broke my heart. Yesterday, I was very disturbed that this had happened, and this is what's happening now. People are dying at home because of corporate greed, because our healthcare industry is profiting off of the deaths of our citizens. And this is criminal, this is unethical. In our hospitals, the reason rationing care is happening is because it's to maximize profit.
Exactly.
We were already understaffed before the pandemic. That's how hospitals run. Understaffed and underprepared for emergencies. If we have an earthquake, we are screwed. We are doomed because we have a pandemic. We have one more emergency, and that's it. We're done for. Okay? We will see countless deaths. And this is criminal. This is unacceptable. that our citizens, our people are dying because of corporate profit, because of the insurance industries. Hospitals got bailouts. They are making record profits right now. There's no beds available because they never prepare for beds. They never prepare for emergencies. They never have extra beds. They never have extra staff. That's why the hospitals are overwhelmed right now, because they don't have enough nurses, because nurses are becoming sick with COVID as well. I have many colleagues, friends who are sick right now at home with COVID. Nurses, doctors, other healthcare workers. This is what's happening. And so I'm demanding that Governor Newsom give us health care for all, a single-payer Medicare system in California, and to fulfill his promise to nurses, who endorsed him and supported him during his campaign. Do your job, Governor Newsom. Thank you.
Right. Do your job. 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 Do your job.
Hi everyone, my name is Dr. Paul Song. I'm an oncologist.
Yeah,
I'm also president of the California chapter of Physicians for National Health Program.
yes.
It's really a kind of a sad time right now when you think about it. New Year's Eve is supposed to be a very happy, joyous time, but I worry that we as a society have become numb to the number of deaths. And every time we see this number, staggering number that's really unfathomable, it doesn't really sink in. But when you really let this sink in, 350,000 people, and the number is continuing to climb. Having lost two close friends in 9/11, and I remember the grief that we had there, but I feel like the same type of grief is lacking for something that is turning out to be 10, 20, 100 times more tragic than that. And a couple things that I just want to point out that this pandemic has really exposed is the tremendous amount of lies we've been told about our healthcare system from both sides of the aisle. During the Democratic debate, we heard that a single-payer system would kick hundreds of thousands of people, hundreds of millions of people off their employer-sponsored health care. Well, the pandemic has done that, right? With all the people that have lost their jobs, think of how many people that have lost their employer-sponsored health care in the blink of an eye. We've also heard people say that, any type of government-run health care program would lead to rationing of the care. But look what's happened now. We're rationing care here in California. Just 2 days ago, the LA Times reported that hospitals, particularly in our underserved communities, are having to ration care because they've run out of beds. How does this happen in the richest country in the world? So what I would just say is let's look at a couple other things about why is it that disproportionate deaths have happened in disadvantaged communities.
Yes.
These are communities that have food deserts, that live near poor air quality, who make their lungs more susceptible to infections to begin with. And then on top of that, they don't have the proper health care, and they have co-pays and deductibles so that when they do feel something, they don't go get the care that they need. This is not a healthcare system that we should be proud of. This is a separate and unequal apartheid healthcare system.
Right.
So this has exposed so much that's so wrong about this. And at the same time, Congress is glad to pass bills to allow us to go buy COBRA coverage instead of actually giving money directly to a healthcare system that would be much more human, just, moral, and cover more of our symptoms.
Yes.
So one of the things I would just ask is that the governor of California has been able to dine and bring lobbyists and the head of the California Medical Association to the table. Well, it's time that he allows all of us to have a seat at the table too. To demand a healthcare system that works for all of us. I would ask all of you to just do not believe the lies. At a time where over 50% of Republicans and 80% of Democrats demand a single-payer Medicare for all system, it's time our legislature here in California and in Washington, D.C. does the same. But what we do know is the biggest controlling voice in Sacramento is not us, the people. It's the corporate lobbyists. It's the people that represent the private insurance industry, the hospital association, the pharmaceutical industry. But it's time that we have an equal voice in Sacramento, an equal voice in LA, and an equal voice in the nation. So thank you very much.
Hello, my name is Michelle Manos, Michelle. Manos. I'm speaking today on behalf of Project Mask Los Angeles. I'm the co-founder and project director of this project that has made and distributed 10,000 fabric masks to people without access to masks in our communities. I also work with a large food bank and a community shower service. And I represent and I'm speaking on behalf of the people who are suffering in silence and in the shadows during this pandemic. We know, and you've heard from some of our other speakers, about how this pandemic is hitting the most vulnerable the hardest. People of color, people of low income, people who already live in communities that suffer from environmental degradation. What we see when we do this frontline community work, our food lines are growing. More and more people are moving into their cars. More and more people are not able to make ends meet financially. What does $600 do to someone who lost their health insurance when they lost their job in March or April? Nothing. It is an insult. Our political leadership has failed at every level throughout this pandemic to the point where the United States has become the laughingstock. And not only the laughingstock, but we are a world danger now. We are a giant hotspot in this country because of our failed political leadership. So I want to thank Healthy California and the Healthcare for All Coalition for bringing attention to this, to remind us of the promises that this governor made when he asked for the support of progressives, when he asked for the support of the community, and when we showed up in good faith and made him the governor of the greatest state in the country. And we are waiting on you, Governor Newsom. We are waiting on you to fulfill your promise to the people, because your vulnerable citizens are suffering, and people are suffering in the shadows, and it is your responsibility. So on behalf of everyone who's on the front lines of this, we are here to say, today we demand better from Governor Newsom. Thank you.
Do your job! 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 Do your job!
Good morning, California. Mike. Closer. Lift your shield a little bit. Can you hear me now? Can you hear me now? Yeah. Okay, thank you very much. I don't know, there's a bunch of cars going by. I don't know if you're able to hear me, but my name is Betty Toto. That's B as in boy, T as in Tom, T as in Tom, Y, Toto like the little dog, T as in Tom, O, T as in Tom, O. And I am Healthcare for All Los Angeles' co-director and the chief of the state Healthcare for All California organization. First, I'd like to extend the condolences to all who have passed because of this virus, and all who are ill now and struggling and trying to save their lives, and those that are trying to save them as well, our frontline hospital workers. Well, this number right here represents families. This number right here represents souls. But this number, cumulatively, because we do not have a Medicare for all, healthcare for all, single-payer system in our country, 68,000 people a year pass. They pass away because they have no insurance or they are underinsured and they cannot get the care that they need. That is continuous. Before the pandemic, we need to stop this. So right now, COVID-19 thrives. It thrives on our profit-first healthcare system.
Right.
And the solution is a California single-payer guaranteed healthcare for all program. Single-payer now! So we are now, again, demanding that he can. Do all that he can. Do all that he can, Governor Newsom, to apply for the 1332 waivers from the federal government within the first 100 days of the Biden administration. That Governor Newsom lobbied state legislators to introduce a California single-payer guaranteed health care bill for all, and promote its passage within the first 100 days of the Biden administration. We also asked Governor Newsom to pledge to the people of California that he will sign the legislation as he promised during his campaign by 2022.
Yes.
Thank you and have a happy year.
This will conclude our press conference. What we are going to be doing right now, we're going to be lining up. We're going to be heading north to Colorado Boulevard. We're going to be traveling the same route that the traditional road parade travel. We thank the member of the media for being here today. We wish each one of you a happy new year.